Hello and welcome to this video for Paper 2, Health and the People. This video is going to go through Theme 2, which is all about public health and hospitals over time. And the information that I'm going to go through on this PowerPoint is all in the summary sheets that your teacher will have already given you, and there should be 4 of these that cover each of the 4 time periods. Before I begin talking through the information, it would be a really good idea to pause the video here and have a go at the first bit of a black pen, red pen activity. The idea is that you would pause the video and write down everything you can remember without looking at any notes about what public health conditions were like in each of these 4 time periods, and also what kind of outbreaks of disease they suffered with, and even things like what hospitals were like. So you could start off with medieval, write down everything you can remember about these 3 different areas here, then move on to Renaissance, 1800s and 1900s. Now, it doesn't matter if when you're doing this you find that you actually can't remember that much. Why this is going to be useful is it will help you realise what areas you need to pay particular attention to when you're watching this video. So it would be a good idea now to pause the video here and have a go at just writing in one colour pen all the stuff you can remember about those 4 periods. Again, this is an optional activity, but as you're watching the video where I'm going to talk through these 4 different time periods, it would be a good idea to try and write some very brief notes on your A3 paper. You don't have to write down every single detail because you've already got it typed on the sheet, but you could decide to select some really key information and put it on this one A3 sheet if you wanted. We're now going to start thinking about the information you need to know. And to start with, for the medieval period, we need to think about what public health conditions were like. Basically, what were the towns like? What were the living conditions like? Were they any good? Now, there's a really good documentary which we would have shown you some clips from in lesson. But if you're still unsure at the end of this topic, it would be a really good idea to watch Dan Snow's Filthy Cities, because that has a really good overview of what conditions were like. So generally, living conditions in towns in this period, and we're thinking here about the year 1000 to about 1450, living conditions were really poor in the towns. Generally, houses were quite crammed together into a very small space. Many people didn't have access to clean water. People were doing things like throwing their toilet waste out onto the streets, because basically there wasn't really any regulations for buildings and waste disposal. You know, it wasn't illegal to carry out these acts and just throw stuff into the street, so many people did. Clean water generally was in short supply. Water was often taken from rivers and streams, which was contaminated with waste because they would throw things like their toilet waste into those rivers. There were some people that ended up drinking more things like beer rather than water, because generally it was seen as being safer at that time. Now, the government didn't really take any responsibility for making public health better. There are a couple of laws that we're going to talk about, including one that was passed in 1388, but generally they weren't enforced and public health was still poor, even towards the end of the Renaissance period as well. However, we don't want to say that there was absolutely no improvements to public health in the medieval period, because they did actually have some good things. For instance, some local authorities did pay for some gong farmers who would basically clear out the human waste from cesspits. And some medieval people were a bit cleaner than others. For instance, there is evidence of bathhouses that existed where some people could pay a set amount of money and go for a bath, but obviously their standards of cleanliness are nothing in comparison to our standards today. So generally towns were pretty dirty, but the monasteries that were often in more rural locations were much, much cleaner and had much better public health conditions. We're now going to think about the medieval period and the Black Death. Now, when you're writing about public health in the medieval period, you want to be able to use the Black Death as an example that actually kind of demonstrates what public health conditions were like. And obviously, this is a fantastic example to use in an exam answer. So the Black Death, the plague, is something that arrived in Britain in 1348, and people were terrified about its arrival. It had been spreading from Asia into Europe, and it had been basically completely ravaging countries like Italy and also France in 1347. So people were very scared about it coming to Britain, and obviously it did in 1348. And it's believed to have arrived on trade ships from China. So in terms of factors that kind of led to this outbreak of disease in Britain, communication, one of the 7 factors that we've got to know about, is really crucial here. Now, people were absolutely petrified of the Black Death because they had no idea what caused it, and so many people were dying from it. Now, when we think about the impact of this, we're thinking about 25 million people in Europe and about a third of the population in Britain dying. In some places, it was even higher than that. For instance, in a town called Jarrow, 80% of the population there died of the Black Death. So it was truly terrifying to the people. And because they had no idea what caused it, they therefore had no idea how to stop it spreading or how to treat the plague. It's actually very simple. It's caused by a bacteria, and today we would treat it with antibiotics. But obviously, they're not going to discover those kind of things until the 1900s. So therefore, it completely destroyed so many communities in places like Britain. Now, they didn't agree on what caused it. All different physicians and doctors, and even just ordinary people, had all different types of ideas about what caused it, from things like planets being misaligned to the belief that it was caused by miasma or bad smells. Some people believed that it was just because lots of people's humours were out of balance. And many people believed that because so many people were dying in the scale of this disease, they thought it had to be caused by God, who was really angry at people committing sins and was therefore punishing the population as a result. Now, depending on what they thought caused the plague would impact how they decided to try and treat the plague. For instance, if you thought that God being angry at you for committing sins was the reason that the plague was caused, that would mean that people's response in trying to prevent it or to try and treat the plague would be doing things like praying a lot. There were even some groups of people called the flagellants who publicly whipped themselves to try and show they were sorry to God, and they also did things like fasting. Other people who believed that miasma was the cause did things like carried sweet-smelling herbs, things like lavender, to try and make sure that they didn't catch the plague. So lots of people tried lots of different things to avoid getting it, but obviously these weren't very effective. There were even some locations, although this happened to a much greater extent during the Great Plague of 1665, but there were some locations that actually tried to shut themselves off and quarantine themselves. For instance, the village of Eyam in Derbyshire is an example of a village that tried to stop it spreading by closing themselves off. And some of you might have even been on a trip with your parents to that location. Now, the Black Death was obviously something that was absolutely horrendous. So many people died, at least a third of the population. Some historians think it's more like 50% of the population of Britain. And although it was absolutely horrendous and it completely damaged families, there were some positives that came out of this. First of all, for some peasants who had been used to being forced to be on a low wage because there were so many peasants and they therefore weren't in demand, some of them actually benefited from the Black Death because they could charge increased fees for their work and could get higher wages because they were so needed by the wealthy who had lost so many of their peasants to the Black Death. So it did improve some people's lives that managed to survive, and it also did lead to some improvements with public health, although obviously not that many because there's still problems with the Great Plague in 1665, only 300 years later. So as a result of the Black Death, some towns and cities, places like London and Coventry, did start to clean up by the 1400s. For instance, in 1388 in London, Parliament passed the first law requiring people to keep the streets and rivers clean, and they even said that they would fine people £20, which is an enormous amount of money at the time, for throwing waste into ditches and rivers. However, even though that's progress with the fact that they are considering laws like this, it obviously isn't very easy to enforce, and it was very difficult to catch those who disobeyed them. So it wasn't necessarily the most effective of laws, but it was still showing that there had been some progress in that they were starting to have a little bit more of a sense of their responsibility to try and maintain public health conditions. The last area we're going to think about for the medieval period is about what the hospitals were like. Now, we've already mentioned that conditions in the towns were pretty horrendous, but in terms of the hospitals, they were cleaner than what the average town would have been like. And that was because most hospitals at the time were attached to monasteries or run by monks, and often they were in more rural locations. Now, there's quite a lot of them. There's at least 160 created during the medieval period, although they do really range in size. Some of them, for instance, had 100 beds, and some of them only had 10 beds, or even in some locations, only 5 beds. So they did range in size, but there is over 160 of them in Britain at this point. One of the first hospitals that was actually set up in England was St Bartholomew's Hospital in London, which was set up in the year 1123 and is still around today. At the time, that specialised in the treatment of poor pregnant women. Now, what's really important to understand about hospitals in this period is that they are not places of treatment. They were places of care. Remember that for many people, they believed they became ill because God was angry at them for sinning. And therefore, the monks and nuns that are working in these Christian-run hospitals don't want to give them lots of treatments because they believe that the main treatment should be prayer and trying to get God to forgive you. So they did use some herbal remedies, and they were often quite skilled at this in comparison to ordinary people at the time. However, the main form of so-called treatment was supposed to be prayer. And remember that really key point that they generally did not believe in treatment. It was about caring for these people. And people that would go to the hospitals were normally the poor who couldn't afford a physician, because remember there's about 100 physicians or doctors in England in the year 1300. So they'd been very expensive and outside of the budget of these ordinary peasants. Hospitals didn't take in everyone. Obviously, there was limited beds and there wasn't that many hospitals around. And they, for instance, didn't actually want to take in people that had infectious diseases. For instance, a disease that was causing lots of problems in the medieval period was leprosy, which had basically been brought to Britain through the crusading knights that had gone off to try and regain the so-called Holy Land. When they came back, they basically brought leprosy with them. And there are about 20,000 leper houses, basically places to kind of keep them away from the rest of the population because it was a contagious disease that were around in Europe in the medieval period. So they didn't let in people with infectious diseases, and some hospitals even did things like banning women altogether. So overall, these hospitals then did exist in the medieval period. They were generally a lot cleaner than medieval towns, and that's because they were often isolated. They were normally built near to rivers, which was obviously beneficial because it meant that they would be able to access water, and also obviously the water would generally be cleaner because there wouldn't be as many people dumping waste into it. And they even did things like thinking quite cleverly when they were building their toilets over these rivers, with the fact that that waste would be kind of taken downstream rather than being exactly where they were then going to fill up their water jugs and things like that. Monks generally as well had better hygiene, as for religious reasons they believed in bathing once a month, which was much more than the ordinary public would have bathed. So generally they were cleaner. But if we compare the hospitals in Europe to the hospitals in the Islamic world at this point, and in places in the Middle East, their hospitals were just nowhere near as good as these Islamic hospitals. For instance, in places like Baghdad and Cairo, they had much more advanced hospitals than what we had in Britain at the time. They even did things like training some doctors there. So they kind of played a really crucial role, and they also at this point treated patients, not just caring for them. Remember that really key point about medieval hospitals: they were places of care, not treatment. It's only in some of these Arab hospitals that they believed in actually treating them, because they believed in more rational causes of disease rather than just believing that, for instance, God was punishing people for their sins. So we've now got to the end of the medieval period. If you want to pause it and make some notes, this would be a good time to do so. Moving on to the early modern period. So generally at the start of this period, in about the year 1450, there were still all of the issues that remained from the medieval period in terms of what towns were like. So still lots of problems with overcrowding, poor living conditions, dirty streets, and generally a lack of knowledge about how to improve public health, because obviously they still don't know about things like germs until 1861. Even then, after that, it still takes quite a long time before they actually act on trying to clean up the towns. And it's not really until 1875 and the Second Public Health Act that they do this. Now, obviously, they have an outbreak of plague during this period as well in 1665, the Great Plague that we'll talk more about in a second. And essentially, that was caused by the fact that we have got these dirty and cramped conditions that attracted the rats that carried these fleas, that then led to the spread of the Great Plague in 1665. Now, after the Black Death in 1348, plague didn't just go away. There were lots of kind of minor outbreaks of it, but the next major one is the one that breaks out in 1665, which killed about 100,000 people, about 15% of the population of London. Still absolutely enormous, but obviously less than the Black Death, which killed at least a third of the population of Britain. The Great Plague is one of the key diseases that you need to know about for this early modern period. So I'm going to talk through what did they understand about what caused it, and you're going to see that there's lots of similarities with what they believed when it came to the Black Death. So at this point in 1665, they still had no idea what actually caused the plague. They believed in lots of the same causes. For instance, they believed that God was punishing them for their sins. They believed that bad smells and miasma was causing it, planets being misaligned, imbalance of the four humours. All of those previous ideas that they had remained. So in lots of ways, there had been continuity with that, and there was lots of similarities, even though it had been 300 years since the Black Death. Their understanding of disease hadn't really made any progress. There were a couple of new ideas and what they believed caused the plague. For instance, there were lots more people that thought things like cats and dogs were actually the cause of the Black Death and the Great Plague, because they were basically dirty animals that they believed were causing bad smells, which was then causing the Great Plague. So generally things were very similar. But the way that they responded to the Great Plague was much more effective. And this is one of the reasons why the death toll is high, but it's not anywhere close to what it was when it came to the Black Death. Because obviously we're thinking here about 100,000 people dying, about 15% of the population of London, in comparison to the Black Death, which killed over a third of the population of Britain in total. So both terrible outbreaks of disease, but obviously the Great Plague did not kill as many people. So in some ways, we can say that there has been some real progress with public health by the time we get to the early modern period. The conditions in the towns are still pretty bad, but the way that they're responding to outbreaks of disease has really, really improved. So this is often down to the Mayor of London, and the Mayor of London acted quite decisively in this time period to try and stop the outbreak of plague. For instance, he did things like saying that he wanted all of the pubs, the taverns, all the theatres, all the kind of places where people would meet up in groups to be closed down, because he didn't want it to spread from person to person. And obviously that was a very sensible move. He also did things like stopping trade with affected towns. He also introduced a new system where people that caught the plague, that had symptoms of the plague, whether it was the bubonic plague that had all those buboes that would appear in their armpits and their neck, or whether it was the pneumonic plague that, caused people to cough and sneeze a lot. Either way, he said if anybody was showing any kind of symptom of the plague, they had to be shut in their house. Their entire family had to be shut in their house with them, and they'd be shut there for 40 days with a watchman outside to make sure that they didn't escape. And after those 40 days were up, they would then allow them to leave. Although obviously, in most cases, all of the family would have then died. But he then ordered that their bodies were to be buried in graves that were at least 6 feet deep, to try and make sure that those bodies didn't basically contaminate other bodies. So there had actually been some real progress here with the Mayor of London's actions, because that's much more about kind of central government taking more of a leading role in this, much more than they did in the Black Death. Essentially, they didn't really do anything in the Black Death, but now the Mayor of London here has taken some quite decisive action. The King, at this point as well, Charles II, also ordered some days of public prayer and fasting. So basically, he also took a role in trying to stop the outbreak of the plague, although obviously his actions were less effective because he was focusing on the idea that religion had been the cause, and obviously had no idea that it was bacteria. So generally there had been some real progress in this period, with them acting much more decisively, with them doing things like collecting dead bodies, closing caverns, burying people outside the city walls, digging deep graves. But there was also some things that they did that weren't very helpful at all, like for instance employing people to kill stray cats and dogs. Obviously actually did not make it any better, because it was the rats that were carrying these fleas that then bit humans, and obviously getting rid of things like the stray cats was actually not very good for that. But still, there had definitely been some progress, and we can see that with the way that they responded to the Great Plague. Final area to know about is smallpox. Now, smallpox is kind of on the cusp really of the early modern and 1800s period, because Jenner makes his discovery about smallpox in 1796, so right at the end of this period. But it's still important for you to know about, and you can use it in an exam question on the early modern or even the 1800s period. It'd still be relevant then. So smallpox was a deadly disease that had killed a lot of people. For instance, in 1796 alone, one outbreak of this highly contagious disease killed 35,000 people. And that is the year that Jenner began working and made his discovery. So Jenner had basically used the kind of power of observation and had noticed that milkmaids who caught something called cowpox, which wasn't fatal, from cows, did not catch smallpox, which was deadly. So in 1796, he took pus from a cowpox scab and injected it into a healthy 8-year-old boy called James Pipps. 6 weeks later, he then injected the same boy with smallpox, a disease that was deadly and killed between 30 and 60% of the people that caught it, and noticed that this little boy showed no reaction. So he was therefore able to show that cowpox had prevented him from catching smallpox. He then went to a society to try and kind of tell them about his discovery, and they didn't believe that he had enough evidence to prove that cowpox stopped smallpox. So he then tried it on his own 11-month-old baby, and then again that baby survived smallpox, so therefore they kind of had enough proof. Now, it took quite a long time for the general public to accept Jenner's discovery. This was a really radical idea, and one that hadn't been done in the past. Doctors at this time preferred to use something called inoculation, which they'd had since 1721, and was an idea that was brought over from Turkey by a lady called Lady Montagu. And inoculation was basically taking the pus of a smallpox scab and rubbing it into a cut on a healthy person, and obviously that wasn't great, because you were taking the deadly bacteria in smallpox and putting it in, and so sometimes some people survived, and sometimes some people died from it. So they didn't have a previously great method of preventing smallpox, but doctors used to make a lot of money from inoculation, so they were reluctant to use Jenner's ideas. Some people believed that having been given cowpox, they could turn into a cow. And that's why when we think about the word vaccination, vacca in Latin means cow. So some people believe that it would lead to them becoming cows. But mainly people opposed it because when they asked Jenner why it worked, he couldn't explain it, and that was quite disconcerting to people. Even now there are people that don't like vaccines, even though we have scientists that can kind of, talk through the benefits of them and kind of explain the logic behind why vaccines can be so effective. But at this time, Jenner himself can't explain it. So a lot of people didn't like that. Now, in terms of public health, Jenner, did so much by himself, but it's also the reaction of the government as well, and how they kind of took on his work and decided to try and make sure that it reached as many people as possible. So smallpox didn't just go away in the 1700s after Jenner made his discovery. Instead, there were lots of other little outbreaks of smallpox. For instance, there's one that takes place between 1837 and 1840. So the government then responded in 1840 by saying that vaccination for smallpox was going to be free to all infants. So trying to encourage parents to give their children this smallpox vaccination. And in 1853, they even made it compulsory. However, they didn't strictly enforce it. Now, there was even an anti-vaccine league that was set up in 1866 to go against this, but the government, remained strong on it and said that parents could be fined if they didn't vaccinate children. And eventually, smallpox was eradicated. It was declared eradicated by the World Health Organization, WHO, in 1980, which is pretty miraculous that we've managed to get rid of this deadly disease through vaccinations. So smallpox is really important as an outbreak of disease, but it's also a really good example to use for how the government improved public health. They've taken this idea and then they funded these vaccinations, which is absolutely incredible. Final area you need to know about for the early modern period is about what the hospitals were like and whether they've been very much progress. Now, when we think about the medieval period, remember they've been places of care, not treatment, and there have been lots that had been set up by the Catholic Church that were connected to those monasteries. Now, during this period of the Renaissance or early modern period, we're thinking here about the 1450s to the 1700s, there have been lots of different changes that took place in this time. Now, you might already know from when you were doing primary history that Henry VIII wanted a divorce from his first wife and the Catholic Church refused, so he created his own Church of England. And then what he did is he decided to shut down all the Catholic monasteries which had the hospitals attached to them. And he did that in the 1530s when he wanted to marry Anne Boleyn. So that meant actually between the 1530s and the 1700s, there were very few hospitals because they had basically all been shut down by Henry VIII. However, when we get to the 1700s, there's what's known as the hospital boom, and that is thanks to religious and charitable donations. Even though Henry VIII changed the religion of England, they were still very Christian, and whether they were Catholics or Protestants or something called Puritans, people generally believed that it was part of their kind of religious duty to look after the less fortunate than them. So there have been lots of donations and they'd created lots of new hospitals in the 1700s. There was even some doctors who started doing training at these new hospitals, and some medical schools were then attached to these hospitals, which is something we still do today. They had general hospitals for the sick, and some people that were poorer got their treatment for free, but most rich people still tended to get treated at home by private physicians rather than attending these hospitals. They even set up specialist hospitals as well for people that were suffering from venereal diseases. They also set up things like maternity hospitals and even created ones for people that were mentally ill as well. There was even something called the Foundling Hospital set up by Thomas Coram in 1741, which was a place for abandoned children that has been represented in this picture on the top right. Basically, they introduced a lottery system where children who were orphans who would generally struggle because obviously they didn't provide very much for children at this point. They were basically given a chance to have somewhere to live, food to eat, and they would also get some training so that when they had to leave this foundling hospital, they would be able to be skilled enough to go and get a job and to be able to support themselves afterwards. In these hospitals, they still carried out some kind of similar things, like just giving them care and a warm bed and place to stay and shelter and things like that. But they also did start to actually treat people in these hospitals as well, especially in the 1700s. They were doing things like using some herbal remedies, but they also, especially in the kind of 1500s and 1600s, and the relatively few hospitals that there were, they were also carrying out other treatments as well as herbal remedies, like also using the four humours. But by the time we get to the 1700s, the four humours and doing things like bleeding and purging people is certainly a lot less common, because people are actually accepting the ideas of people like Harvey. And don't worry if you're watching this at the end of theme 2, we'll talk about who Harvey is when we do theme 3. So hopefully that'll make more sense later on. So hospitals, generally at the start of this period in the kind of 1450s, still lots of them around. After Henry VIII was around the 1530s, there were fewer hospitals, but the ones that were around were still using some of the earlier treatments of things like purging and bleeding. And then hospitals really start to change in the 1700s. So we've now come to the end of the early modern period. You might want to pause the video here if you want to make notes on that time period. We're now going to think about what were public health conditions like in the 1800s. Now, the 1800s is when Britain is going through the Industrial Revolution that essentially starts in about the 1780s, but really gets going by the time we get to the 1800s. Now, during the Industrial Revolution, many people moved from the countryside to towns. Before the Industrial Revolution, about 80% of the population lived and worked in the countryside on things like farms. And then by the time we get to this industrial age, it's only about 30% of people that are living and working in the countryside. So there's been a massive shift in where people are living and therefore where people are working as well. So lots of towns, places like Manchester and places like Leeds, they ended up being basically expanded massively in this time period, because that's where they built lots of these factories that people worked in. But because these places were kind of built so rapidly, they were generally built pretty quickly and pretty poorly. And generally the housing was pretty poor quality. And they also had to deal with obviously things like horrendous levels of pollution. Whenever you think about the Industrial Revolution, you're probably thinking of those factories and about the kind of horrendous public health conditions with them. They still didn't know at the beginning of this period about the problems with waste. They didn't know that doing things like throwing waste into rivers could cause problems like cholera. They had no idea about that still didn't have good quality toilets, and up to 30 families could share one single outside toilet that we shared in the street that generally was only emptied about once every 6 months. So as a result of these really poor conditions, overcrowding, problems with waste, that then drastically reduced people's life expectancy. For instance, we can see the statistic here in the East End of London in 1842. The average life expectancy for labourers, for the poor, was 16 and 45 for the rich. So a lot lower than obviously what we have today. Also, 57% of children died before the age of 5 due to poor maternity care, but also poor conditions where they were living as well. And because of these conditions, contagious diseases spread really quickly. Things like typhoid, typhus, TB, which is tuberculosis, cholera, things like smallpox, and also things like measles as well. And we can tell how bad public health conditions were because the government asked a man called Chadwick to write a report on the state of public health in 1842. And this was prompted by the arrival of cholera, which came to Britain in 1831, which killed 50,000 in its first outbreak. And then there were other outbreaks that happened over time as well. For instance, another 20,000 or so had died in 1842. So they asked Chadwick to write a report on the state of poverty and public health, and he basically wrote this scathing report about how terrible things were, how living conditions in towns were way worse for people's health than in the countryside. And he was somebody that was a wealthy lawyer, so he was suggesting this was a problem for the government because it was going to basically cost them more if they couldn't look after the poor. So he suggested that the government should do things like passing laws for proper drainage and sewage systems, and he suggested that this should be funded by local taxes. And this was one of the reasons why the government passed the first Public Health Act in 1848. What Chadwick said wasn't perfect, because he also talked about taking all of the waste from the city and dumping it into the River Thames. So obviously he didn't know everything, but he was certainly talking about the government getting more involved, which was obviously a really positive step. We now want to think about the 1848 Public Health Act. This was something that was passed as a result, really, of things like cholera, but also to some extent Chadwick's 1842 report also put pressure on the government. So this was passed in 1848, and there are lots of positives of this act. For instance, it is the first act of its kind. It's a monumental change. If you think about how much the government has got involved in public health before, it's always been really limited. You know, things like the Mayor of London doing things like putting in place a few measures to try and stop the Great Plague spreading. And they've done a couple of things as well, like in 1840, making the smallpox vaccination free to all infants. But generally, they haven't got that involved in public health. And so the 1848 First Public Health Act is a real change and shows that they're actually actively getting on board. We're doing things like setting up a central board of health, and some towns did take it really seriously. You know, for instance, places like Leeds did actually act on this act, and they improved their facilities, and they did make a real change to the standard of living of the population of Leeds. The government could even now, using this act, force towns with a particularly high death rate to take action over water supply and sewage. They didn't yet know the link between cholera and dirty water. They don't know that until 1854, so they didn't act on it straight away and take it really seriously, but still they've got the potential to act here. So there were some real positives. However, generally as historians, we kind of look down on the 1848 Public Health Act because it wasn't compulsory, and therefore lots of places chose not to clean up the towns. So local councils didn't have to act on this, and they had to pay for the changes themselves. Therefore, many of them didn't do it. And within 10 years, the Board of Health that had been created had then been dismantled. These measures were also really expensive, and they were expected to pay for it themselves. So some councils did borrow a lot of money to be able to fund these changes, but many others chose not to, because they would have to use the taxes that were often paid by the rich, and they were worried about upsetting wealthy people, because remember, at this time it is only wealthy men that can vote, so the government wasn't necessarily very keen in upsetting those men. So the first Public Health Act, big deal that it was created, but it wasn't compulsory. We've already mentioned cholera. It came to Britain in 1831 as a result of trade with India. This was a really terrifying disease because people that caught it basically suffered a really miserable death. They ended up being sick and ill with things like diarrhea, basically until they died of dehydration. It would even do things like turning their fingers black. So it was an incredibly painful and slow way to die, and no matter how much water they drank, basically their body expelled it anyway out of either end. So this is something that killed 50,000 in 1831, and by the time we get to 1854, it's killed over 100,000 people, and obviously people were incredibly scared of it. Now, there's a man called John Snow who managed to actually work out what caused cholera, and he did this by mapping the deaths of cholera victims. So he noticed that there were lots of victims dying of cholera in this area of Soho in London. So he got a map of the local area and he plotted all of the deaths of the people, and he basically managed to work out that they were all getting their water from the same pump in Broad Street. He then went and removed the handle of that pump, and when people couldn't get water from that anymore, the deaths of people with cholera stopped. So he then was able to prove that it is contaminated water that causes cholera. And what he actually found is that there was a toilet that was basically leaking its sewage water into that water supply. Now, the government then knows what causes cholera, but at first it didn't actually act. It didn't act until it started to really bother them in 1858, when we get something called the Great Stink. The Great Stink was when there was a huge amount of waste in the Thames, because obviously even people like Chadwick had said that it was a good idea to dump waste there. When that was then combined with a particularly hot summer, it led to a smell so bad where Parliament refused to meet. And that was something that then prompted them to act, because it was starting to impact them, not just the poor in places like London. So they commissioned a man called Bazalgette to try and build a new sewer system, and gave £3 million, which is the equivalent of billions of pounds in today's money, to try and build these new sewers, many of which are actually still around today, and this became the blueprint for most European cities. So this was incredibly advanced at the time and did make a real difference. And they were acting on this because of the Great Stink, but also they knew from 1854, where John Snow had proven the link between contaminated water and cholera, that this was really crucial for the health of the people. So there's a lot of reasons why the government then passed this 1875 Public Health Act, and you need to know about some of these and why they then led to this massive change. So the second Public Health Act was a monumental change. It now forced councils to appoint health inspectors and sanitary inspectors to make sure that these laws on hygiene were followed. It said that they had to provide clean water. It said they had to do things like collecting waste, and they had to appoint a medical inspector who would make sure that these laws were followed. So this was a real change. And there's lots of different reasons why the government then passed this 1875 compulsory second Public Health Act. So one of the reasons why it was passed was because of the Great Stink, which prompted government action. But also generally there started to be a real change in attitude of the government. They were less about laissez-faire or self-help, and they started to believe more that it was their job to do something. There was also the work of Louis Pasteur, who had published about germ theory in 1861, and that had started to convince the government that they actually need to do something about preventing bacteria and things like germs as well. There's also the report of Chadwick from 1842, where he had said about the problem of poor public health and how that is going to cause more issues in the future. And obviously there was also things like the work of John Snow, where he is proving the link between dirty water and cholera in 1854. But importantly as well, there was a change to who could vote in 1867, and for the first time working class men could now vote. The government now has more of an incentive to try and act to improve the public health conditions and the conditions in things like the towns, because otherwise they're going to be voted out of power. So it then encourages them to act. So the second Public Health Act, really important, forces change, really does lead to the towns clearing up over a long period of time. Obviously, it's not an overnight change. However, it didn't solve every public health problem because there were still issues with the fact that lots of people were living in poverty and couldn't afford, things like food. So that's the end of the stuff on public health for the 1800s. We're just going to think about hospitals next, and then after that we'll be able to move on to the 1900s. So hospitals in the 1800s underwent a massive change thanks to the work of people like Florence Nightingale. Now, Florence Nightingale was a middle-class woman who volunteered to be a nurse in the Crimean War that took place between 1853 and 1856. But she got involved and went over in 1854. Now, when she got there, she was appalled by the high death rate in the hospitals and the conditions that were there. And she believed that miasma was a cause of disease. So she wanted to try and clean up these hospitals. And she made some changes in these hospitals, doing things like saying people should be provided with good quality food. She talked about things like ventilation being very important. She talked about doing things like boiling bed sheets and kind of keeping things really clean, emptying bedpans and chamber pots very regularly, all these kind of sensible ideas that, to many people were actually quite new at the time. So she did that when she was in the Crimean War and managed to drastically reduce the death rate. She then came back to England and wrote an 800-page report to the Queen suggesting that these changes should be brought in to English hospitals as well. And it then did lead to some of those changes in the English hospitals, and it reduced the death rate there as well. So this was a really big deal, and obviously this was something that had been started by the Crimean War, but then kind of pushed forward by this very charismatic woman of Florence Nightingale. Generally, there was also a kind of greater acceptance of needing to make hospitals cleaner in the 1800s as well, because they started to accept things like germ theory and they believed in things like microbes now. So there have been lots of changes to hospitals thanks to war, thanks to the work of Louis Pasteur, thanks to the work of people like Nightingale. But they also built lots of new hospitals in this period. Obviously, the 1700s, we've seen that there's been a hospital boom, and in the 1800s, we get more hospitals built again. We get things like cottage hospitals that were built for the first time. These were basically hospitals that were supposed to mimic people's homes to make them feel more comfortable. And they even started to create even more specialist hospitals, for instance, doing things like creating Great Ormond Street Hospital in London for children. And by the time we get to the year 1860, there were 36 specialist hospitals in London alone. So they're kind of continuing with this hospital boom. So we've now got to the end of the 1800s. You might want to pause here to make some notes. We're now on the final time period of the 1900s or 20th century. So we're going to think about what public health conditions were like to start with. Now, obviously, there had been massive progress made thanks to the Second Public Health Act passed in 1875. And towns at this point generally had cleaned up. But there was another problem with public health now, and that is the problem of poverty, which hadn't been dealt with by things like the 1875 Second Public Health Act. Now, the government didn't realise how bad this was until we had things like the Boer War, and that was taking place between 1899 and 1902. This was something that really shocked the British government, because when they were looking for soldiers to fight for them in this war, they ended up finding that about 40% of their recruits were too unfit to fight in this war. They were basically too unhealthy, malnourished, suffering from problems as a result of poverty. And therefore, the British government realised that if they wanted to be able to protect the kind of security of Britain, they would need to kind of act on this and try and support the people as well. So the Boer War was a factor that led to some improvements with trying to deal with the problem of poverty. But there was also the work of two people called Booth and Rowntree, and each of these men wrote their own report. Booth wrote a report in 1899 and Rowntree wrote a report in 1901, and both of them highlighted the problems of poverty. For instance, when Rowntree wrote his report in 1901, he found that in York, nearly half of the working class people lived in absolute poverty. He found that actually, even when both parents worked, there were still often times, for instance, where some mothers would have to go without dinners to be able to feed their families. And this was about trying to challenge attitudes towards the poor, because a lot of people at this point that were middle class or upper class believed that many people were poor because they were lazy or they made poor financial decisions. And actually, the reports of people like Booth and Rowntree proved that actually there were people who were working really hard but still living in poverty because of that kind of terrible cycle of it. So this is one of the things that then prompted the liberal reforms. The liberal reforms are important because this is one of the first times that the government is actually trying to help tackle the problem of poverty. Obviously, they'd realised it was a problem when it came to things like the Boer War. They'd also realised it was a problem thanks to the work of people like Booth and Rowntree. And the Liberal government were very motivated to try and act on this because a new party was created in the year 1900 called the Labour Party. And they were worried that if they didn't try and help the working class people, then they might start voting for this new political party. So they passed a series of reforms between 1906 and 1914, which did improve many people's lives. For instance, they introduced free school meals in 1906, and this is something that we still have to this day. Now, for some children, they didn't even get a hot meal at any point in the day, and therefore it guaranteed that all children across the country would have access to at least one meal a day. And obviously that really improved their quality of life. They even had things like free medical inspections that they brought into schools, because remember, this is before the NHS and most people couldn't afford to see a doctor. So therefore, for some of these children, it was the first time that they'd ever seen a medical practitioner. They also introduced things like the Pensions Act in 1908, which brought in pensions for the over 70s. Now, obviously, that didn't help that many people because at this point, the average life expectancy was lower than that, but still, at least it was helping a few people and it was a radical new idea that they hadn't had before. There was even things like the National Insurance Act that was brought in 1911, which paid benefits and healthcare to those who had paid into the system if they needed to have, for instance, time off work or became unemployed. And even in 1918, at the end of World War I, Lloyd George wanted to try and make sure that he looked after the soldiers who had been fighting so hard in the First World War, and so he introduced something called the Homes Fit for Heroes campaign as well. So massive progress had been made with the liberal reforms, obviously not perfect systems, but still it represented a great change from what had come up before. They even in 1919 created a Ministry of Health, which was set up to look after sanitation, healthcare and disease, as well as the training of doctors, nurses and dentists, and trying to introduce people who could focus as well on maternity and children's welfare. But remember, this isn't free at this point. You'd still have to pay to see a doctor until the NHS was created in 1948. So as you know, the Liberal Party introduced lots of reforms between 1906 and 1914, but these were then built on in the 1940s by the Labour government who was in power then, and they created something called the welfare state. Now, one of the reasons that they acted on this and ended up introducing all of these changes was because of something that was published in 1942, and that is the Beveridge Report. Now, in this report, Beveridge talked about massive problems for the poor in Britain, and he talked about the so-called five giants. And you can see him represented here in this source, trying to tackle himself these five enormous problems in society of things like want, disease, ignorance, squalor, and idleness. So the government wanted to try and act on this, and obviously they couldn't act on it straight away because obviously the Second World War was going on, but they did like the idea of trying to look after people and try and care for its citizens from the cradle to the grave, as Beveridge had put it in his report. So they introduced lots of things to try and help the public after the Second World War. For instance, in 1945, they passed something called the Family Allowances Act, which gave a small payment for children. They also did things in 1947, like passing the Town and Country Planning Act, which set targets for the clearance of slums. Basically, there had been such poor quality housing built in the 1800s that suffered from problems like damp and mould, and they wanted to try and get rid of that housing and build new quality housing for people. And in 1948, the most important of all of the kind of public health actions that have ever happened in the past, we have the foundation of the National Health Service, the NHS, which was set up at the time thanks to the work of Beveridge in his report. It was actually created by the health minister at that point, somebody called Bevan. And this, for the first time, provided free doctors and hospitals, and it was paid for out of taxes. And this was a really radical idea at the time, but is now the kind of one of the foundations of British society. They have introduced other acts as well afterwards. For instance, they did things like introducing the Clean Air Act in 1956, and they imposed things like smokeless zones. And obviously, even today, the government takes an enormous role when it comes to public health. Think about all of their work during COVID and all the lockdowns and all of the guidance that they introduced. The government certainly does take the welfare state further than what we had back in the 1940s. But the 1940s was really radical at the time and was massively building on the work of the Liberals in 1906 to 1914. We've already mentioned the NHS, but it's important that we talk through it a little bit more because you need to know more about the NHS than you do about the other reforms that they introduced. Now, we know that this was created by the Health Minister Bevan in 1948, and it was a system that everybody who was working paid into, but whether you paid into it or not, you could still benefit from the NHS. Even if you were unemployed. And this is such an important event to know about because it represents a massive shift in government attitudes, from the laissez-faire attitude of the early 1800s to them creating things like the first Public Health Act, where they didn't make it compulsory. They then improved with things like the second Public Health Act, and the Liberal reforms represented a massive shift forward as well. But here we've got the kind of the death of the laissez-faire attitude and self-help, with the fact that they're actually providing free healthcare to the entire population of Britain. So what has the NHS meant then? So it's massively improved people's quality of life because now we have free maternity services, free services for children, and this has led to a massive reduction in infant and child deaths. We have lots of new hospitals that have been created. We have free vaccinations. We have eradicated diseases in Britain that lots of other countries are still suffering with. For instance, we don't worry about things like tuberculosis or TB anymore because of the NHS vaccination scheme. So it's really improved people's quality of life. You can see that in the average life expectancy as well, where from 1948 it's risen from 66 to 83 for women today. That's the average life expectancy, and from 64 before the NHS was created to 79 for men. So it's massively improved people's life expectancy as a result of the fact that now everybody can go and see a doctor rather than just people that have money. However, remember, it wasn't always well liked. Even Winston Churchill called it a scourge on the population of Britain. He compared it to Nazi Germany. There were lots of people that really hated it, especially doctors at the start. And actually only 10% of British doctors supported the foundation of the NHS in 1948 because they were worried about the loss of their independence. They were worried about the financial implications for them. And obviously Bevan had to try and make a compromise and said they could also treat private patients as well. So the NHS does have some problems today. They still have issues with things like funding. Demand is always going to outstrip what they actually have. But there's still, massive benefits to the NHS, and it is generally supported by most of the population today. The final area we're going to think about is hospitals in the 1900s. Now, in terms of the changes from the 1800s, there's not massive changes. You know, we saw that in the kind of later 1800s, after the work of Florence Nightingale, hospitals got cleaner. Obviously, as our understanding of bacteria increased, thanks to the work of people like Lister, when it came to things like his use of carbolic acid in surgery, we ended up making hospitals more and more sterile over time. If you're watching this at the end of theme 2 and you haven't yet learned about surgery, don't worry if you don't know what I'm talking about, because we'll cover that once we've done theme 3. But basically, hospitals were now very clean. They had a good understanding of the fact that they needed to sterilise equipment. They needed to try and make sure they were germ-free environments or aseptic environments. We've already seen that there were lots of specialist hospitals created by the 1860s. By the 1900s, get more and more specialist hospitals cropping up all over the country. And obviously, after the NHS is created, hospitals are then run by the NHS, and the government therefore has assumed responsibility for all of those hospitals. So hospitals in the 1900s, you know, big changes, much more modern. Using things like electricity more, using things like new technology more, but still quite similar to the changes in the later 1800s as well. So that's the end of the 1900s. You might want to pause the video here if you want to make any notes on that. You've now come to the end of the information on this revision video. Now, if you did the black pen, red pen start of this activity earlier, you might want to finish it off with now having a go at adding in a second colour everything you can now remember about those 4 periods when it comes to what public health conditions were like, what the outbreak of disease were like, and also what hospitals were like in those 4 time periods as well. So that'd be a good idea, because that would then prove to you what areas you still need to work on, but hopefully you'll now feel a little bit more confident at how much you can remember. And try not to use your information sheets when you do this. You want to just see what you actually now know. If you're still feeling a bit unsure about this topic, this one obviously is a lot bigger than the first one on theme 1. You could then make a revision clock and use these 12 headings, or you could just use A3 paper to make a spider diagram and use the headings that are actually on your information sheets and the slides on this PowerPoint. The final thing that you can do is just try and make sure that you can actually answer the questions on the short answer test. So these should be the same ones that you've got on your flashcards. And on this slide here, I've just put the first 12, which are just about the medieval and early modern period. So you could pause it here and have a go at making sure out loud, or just in your head, or writing it down, that you can answer all 12 questions. And remember that if I put a 3 in a bracket afterwards, that means you want to put 3 things down. If I put a 2, you'd want to be able to say 2 points. So pause the video here to have a go at that, and then you'll find that the answers are on the next slide. So here are the answers to the first 12 questions on the medieval and early modern period. Pause the video here to be able to check whether you've got those answers correct. And obviously, if there's any questions that you struggled with, then just make sure you maybe write down a note of those and the answer, so that you can work on trying to remember that one. So next we have questions 13 to 26. These questions are still on public health and hospitals, but are now focused on the 1800s and 1900s. So pause the video here to have a go at trying to answer those last 13 questions. And here you have the answers to those questions 13 to 26. So you might want to just have a little look at those and make sure that you've got the same sort of answers down. And again, if there's any that you now realise you got wrong, you can have a go at writing a note down of those so you can work on remembering it. Really well done for watching the video. Remember that you can go back and watch certain parts again if you're still struggling with remembering it, and talk to your teacher if you need any more ideas of revision strategies to try and help you remember this content.